it honest.
How are you guys going to manage this right now?
One at a time?
I'd prefer one at a time.
Yep.
I want to know who we're talking to. All right? So who's going first?
I'll go first. I wanted to hear what...
Long time no see.
I know, right? I wanted to hear what your response was going to be to that second to last question. I was kind of disappointed Senator Craven kind of ended the debate there. What was your response going to be to the issue of one population versus the other?
The bottom line is we don't have unlimited resources in this state. There are difficult decisions that need to be made as part of this discussion. We have people, our elderly, people with intellectual and developmental disabilities who depend on Medicaid that are not getting the full array of services that are vital to support them in their homes and in their communities. We are looking at those challenges every single day to look at how we can improve the Medicaid program to better serve the people of this state.
Commissioner, Senator Craven said before that she had never heard of a case of somebody dropping private insurance to get on Medicaid. I guess, what would your reaction to that be? Have you ever heard of that happening?
We have seen when Medicaid expands and you are going from some level of cost sharing to no cost Medicaid, people are going to drop coverage. We know that employers are looking at the Affordable Care Act and are going to make decisions about whether or not they can afford to maintain coverage for their employees. That has got to be part of a forecasting of what the true financial impact is going to be, not only on the state Medicaid program, on the Department of Health and Human Services' ability to fund other vital programs like child welfare, mental health, substance abuse, and on the entire state budget as we grapple with other challenges like education, transportation, natural resources. This cannot be a decision in a vacuum.
Commissioner, there was a lot of questions in there, obviously, about there not being savings accounted for in the calculations as a result of expansion. Do you believe that there would be some savings in certain areas, but that they would be outweighed by the added costs?
This report was attempting to look at variables that we had a confidence level in being able to predict. The savings that are being described are riskier to assess. While we believe there may be some level of savings, that would require the legislature cutting my mental health budget, and I would in turn cut contractors' payments. That's the discussion we need to have in this building if they're prepared, in fact, to make those kinds of decisions in order to budget savings in those programs. Similarly with Commissioner Pont and the Department of Corrections.
I was just going to ask real quick, Bill Lawler with the Press Bureau, about, there seem to be leaving the door open for, in the future, if you're able to design a system that was a lot more efficiently delivering services, lower cost, that maybe in the future you could have the funds to expand Medicaid to some extent. Could you expand on that a little bit and how that might happen? Are we talking many years in the future? Talk about that a little bit.
I'll take it.
Okay.
There are many, many deficiencies today in our Medicaid program. We have an antiquated federal Medicaid program that fails to really allow us to support people effectively in their homes and in the communities. One of the programs that we've talked a lot about are homemaker services, allowing people access to meal preparation, light laundry, house cleaning, things that we know allow people to stay in their homes longer and out of more expensive facility-based services. Medicaid does not reimburse for those services. What we certainly want to be able to explore is whether we could design a program that would allow us to look much more comprehensively at a comprehensive array of services that would better support individuals in their homes and in their communities that could achieve a lower rate of increase in overall Medicaid spending.
Two questions here.
expansion.
Do you think, can you kind of defend your report a little bit to those who are kind of attacking it and attacking you personally? Like, why should we believe what's in your report?
Because we looked at empirical evidence and we used risk adjusters and factors that are real. Per member per month costs will grow. The poverty rate is growing in Maine. It's serious. And the drop factor for people on private insurance is a real factor. The question was asked earlier about will businesses actually drop individuals. One only has to look at companies like Walmart and big companies that have done this. We've seen this in other states. It happens. So the reality is that we looked at those real risk adjusters and built that model based on that. We could not build a model based on something that's almost like pie in the sky, because it would have to pull numbers out of thin air, and where do you begin? So you look at the baseline numbers that the department has, you build in your risk adjusters, and from that perspective you're able to give the state some sort of quantitative analysis for where this is going to move in the future. True, it is true that you could have some savings, but it's very difficult to quantify.
What about
last
this question that some critics have mentioned? They thought your projections of poverty rate increase were greatly exaggerated, and wondering where those come from.
Actually, Eric Randolph is here. I'd like to have him answer that question because he actually built a lot of the...
Bring him to the light, if you would.
To the light. Am I in the light? Am I good? Okay. It's a technical answer, but just to what came up in the hearing is Mr. Alexander pointed out that we had a team that included an actuary, we had a CPA, we had a former chief financial officer who ran a Medicaid program, and what we did was we went about the task to identify those numbers that are real. And what we did was we didn't want to pick just poverty growth arbitrarily. So we spent a considerable amount of time pulling the data in a way that would reflect the true trend. And we used census data mostly for our report. And we also, what we did was we looked at the business cycle. And we used the Bureau of Economic Research. They have a business cycle dating committee. And we identified the peaks along the cycles, and we pulled the data for those peaks. And what that would do is that would eliminate any impact of a recession. And then what he did is we built an actuarial table. He used Social Security adjusters for mortality, and then essentially built an actuarial table to give us real. I mean, the task was, when we were working as a team, was we want to have the best factors for the poverty growth going forward. Now, if you flip into the report, we consider this as one of the risk factors. So what we do is we use a 25% variance. That 25% variance is not arbitrary. Essentially what we did was we kind of pulled various different poverty growth factors from real data and looked how much does it really vary, and it appeared that most of it fit within that 25% variance, and that's why we chose that.
Thanks, Walt.
Has the next report come in yet? It was due on December 20th.
Thanks, guys.
I'm glad it's positive.
Yes, it is. That was the one I